Welcome to this three-part series on psychological safety for pharmacy leaders. I'm excited to be sharing with you part one of this series, which will be where we will discuss how to talk to your employees about mental health and why it matters. My name is Dr. Carly Crew. I'm a family physician with a passion, additional training, and experience in mental health, with a focus on women's mental health. I'm the founder and CEO of Eunoia Medical, an innovative virtual mental health clinic for women by women, where I lead a team of 10 physicians to support women with their mental health in a personalized and comprehensive way, combining talk therapy with lifestyle changes and medication treatment as needed. As a speaker, author, and content creator, I'm passionate about breaking down mental health stigma by speaking openly about my own personal story, educating on the realities of mental illness, and empowering others to take action to improve their own mental health. I'm excited to be partnering with Amy Oliver in creating this series as part of my mission to educate more people on the importance of having mental health conversations in more places, to empower leaders to break the stigma of mental illness and improve the mental health of as many people as possible. So let's dive into how to talk to your employees about their mental health and why it matters. The objectives of this presentation are to explore current data on the impact of mental health in the workplace and why, now more than ever, it is important for you to talk to your employees about their mental health as an integral way to create a culture in your workplace that your team feels safe to reach out for support. As this is a topic that many people are unfamiliar or uncomfortable bringing up in the workplace, we will review some of the most common reasons why we don't ask about mental health, and I'll offer suggestions and tips for overcoming these obstacles. Finally, I'll provide resources for learning more and how to dive deeper into this topic. So first of all, I want to stress that we can no longer act like mental illnesses or mental health symptoms are not happening anymore. While talking about mental health in the workplace would have seemed likely unprofessional or have been unwelcome in the past, it's high time for that culture to change. The days are long gone when we can play ignorant to the impacts of mental illness in our personal or professional lives. In fact, statistics from CAMH show that nearly 6 million people, which is 1 out of every 5, suffer from mental illness in any given year in Canada, and a large proportion of these illnesses will happen during their working years. By the time Canadians reach 40 years of age, 1 in 2 have or have had a mental illness. Furthermore, our mental health is a fundamental part of our overall health, and our mental and physical health is linked. People with a long-term medical condition, such as chronic pain or diabetes, are much more likely to also experience a mood disorder. Conversely, people with a mood disorder are at much higher risk of developing a long-term physical medical condition. Men tend to have higher rates of addiction than women, while women tend to have higher rates of mood and anxiety disorders. Also, mental health is no longer something that's just considered to be a personal issue. That is, the impacts of mental illness far surpass the individual who is suffering. Outside of just the individual, their family members, support people, coworkers, employers, or employees, and their role in society can all be potentially impacted. One of the biggest shifts we need to make when it comes to talking to our employees about their mental health is eliminating the idea that mental health is too personal to discuss in the workplace. With the impacts being so massive and the mental health crisis expected to only worsen over the next few years, it is imperative now more than ever to start addressing mental health in the workplace. In fact, when it comes to mental health issues in the workplace, CAMH states that mental illness is the largest untreated epidemic affecting Canada's workforce right now, and it's likely only going to increase as we begin to see the real impacts of the COVID pandemic on mental health on a global scale. Of those who struggle with mental health issues, a large proportion of them will experience these during their prime working years. And while we know mental illness is impacting the people in our workforce, we also need to be aware of the economic impacts in our businesses and on the economy as a whole when mental health issues are not addressed in the workplace and at the workplace level. The Mental Health Commission of Canada published a report called Making the Case for Investing in Mental Health in Canada. In the report, it shares that the economic cost of mental illnesses to the Canadian healthcare and social support system was projected as high as $79.9 billion for the year 2021. Aside from the national economic impacts, mental illnesses have massive impacts on individual businesses, and this is what is felt on the individual business level. Mental illnesses in your workforce contribute to higher absentee rates, burnout and employee turnover, higher rates of workers' compensation and disability claims, lower employee morale, lower worker efficiency and job satisfaction, and lower rates of overall customer satisfaction. And unfortunately, projections suggest that it's only going to get worse if we don't do something about it. Conservative estimates on the impact of mental health problems and illnesses on lost productivity due to absenteeism, presenteeism, which is being present but less than fully productive, and employee turnover was estimated to be $6.3 billion in 2011. This is estimated to rise to $16 billion by 2041. Over the next 30 years, the cumulative impact of these costs is estimated to be $198 billion, according to the Mental Health Commission of Canada report. It's important to note that not only does mental illness impact performance in the workplace, but the workplace can impact mental health, and this is where we really want to focus on today. Researchers at the Center for Applied Research in Mental Health and Addiction, also known as CARMA, have identified 13 psychosocial risk factors that can lead to an unhealthy, high-stress environment, which is to mental health what hazardous and unsafe workplaces were in the past to physical health. We will elaborate on these factors in other sessions in this series. These factors include the way deadlines, workloads, and work methods are handled, as well as the context in which work occurs, including relationships and interactions with managers and supervisors, coworkers, and customers. CARMA says that when companies embrace psychological health and safety policies and programs, they incur 15 to 33% fewer costs related to psychological health issues. And the truth is that doing something will do something. There is research out of the UK National Institute for Health and Clinical Excellence that estimates that improving the management of mental health in the workplace, including prevention, early action to combat stress, and early identification of problems, could decrease losses to productivity by as much as 30% and result in an annual savings of almost $400,000 in a business with 1,000 employees. With the incidence of mental illness already being so high and only anticipated to rise, and with our employees spending a large majority of their lives in our businesses, we play an important role in shaping the culture of the place they spend so much time in. Not only that, but the reality is also that so many mental illnesses can be treated and managed if detected early and acted upon. Given our employees spend so much of their lives at work, the chances of early detection of a mental illness at work is really high. As business owners and practice owners, we have to recognize the fundamentally important role we have in shaping the culture of our workplaces around mental health and cultivating an open dialogue about mental health in our businesses so that our employees feel more comfortable asking for help or disclosing their own mental health concerns. And like I stated earlier, while the data is overwhelming that there are business and economic impacts of mental illness, it's imperative to recognize that human impacts of mental illness are often not captured in data. Our employees are humans too. There's so much more than what they can produce for our businesses or our bottom lines. If we want to create meaningful impact in the world with our businesses, we must recognize that mental health issues are everyone's problem, including our own. There is good evidence to support the critical role of managers and business leaders in influencing a change in the mental health landscape of our workforce. Entire standards have been written on the importance of and step-by-step of creating a mentally healthy workplace and cultivating a mentally healthy culture. Today, we're going to cover just one small piece of this, which is simply asking your employees about their mental health. As a point of reflection, take a few moments now to consider your own personal comfort level when it comes to having conversations about mental health in the workplace. It's okay if you're feeling a little bit uncomfortable about this. That's why we're here. Then consider some of the reasons you personally avoid asking your employees or colleagues about their mental health. We'll hopefully address most of these today. Finally, I want you to consider what benefits you anticipate could follow from becoming a bit more comfortable having these conversations. What could be potential benefits for yourself, your colleagues, or your organization? Take a moment now to write down a few answers to these prompts. So we've just reviewed why it's so important to ask about mental health and why simply asking your employees can make a big difference to your workplace. So the question is, why don't we do it? Why don't we ask? What's included on this slide is a non-exhaustive list of why I feel that many people don't ask about mental health in the workplace, and we'll explore some of these reasons today. In many situations, managers and leaders in business are hesitant to ask about mental illness because they feel uncomfortable, don't know how to handle disclosures, or are afraid of liability. In the slides to come, we'll cover each of these reasons in detail, and I'll provide you with some ways to overcome them so you can become more comfortable having these conversations. I want you to know that it's less scary than you think to start having these conversations with your team, and the benefits will be well worth it. I also want to make it clear that simply asking your employees about their mental health is not the end-all, be-all for creating a mentally healthy workplace. And this webinar is a small piece of a much larger conversation that should be had about creating a mental health action plan in your workplace. Resources for diving deeper into this work exist from large organizations whose mandate it is to help businesses create mentally healthy cultures, and these will be included at the end of this webinar. One of the biggest obstacles to asking our employees about their mental health, or to talking about mental health at all, is that we feel uncomfortable about it. Despite our best efforts and significant progress in this area, stigma about mental health remains a huge barrier. In the workplace especially, employees struggling with mental illness may avoid disclosing symptoms, asking for or seeking help due to fears of being seen as weak, less than competent to do their job, or less fit for a promotion. So how do we combat mental health stigma? First of all, I want to congratulate you on already taking steps towards this by simply watching this presentation. One of the most important ways to reduce mental health stigma is to have more conversations about mental illness. Because what is left undiscussed or in the dark will always be something that divides us and leaves us feeling alone, shameful, or uncomfortable. Let's dive into each of these points in more detail. We must first seek to understand our own feelings and beliefs about mental illness. We cannot change the bias or stigma in our workplace if we are not first examining our own. This might look like reviewing the statistics I shared about the incidence of mental illness, reflecting on your own experiences, or taking a course about mental health stigma, such as The Working Mind, which we'll share in our resources. In order to reduce mental health stigma, we need to normalize mental health and mental illness as a human problem, that it's not a sign of weakness, but rather a normal part of being human. Even if you have never been diagnosed or struggled with a mental illness, everyone at some point has experienced feelings of sadness, loss, fear, anger, and self-doubt. Many of us have experienced anxiety, panic attacks, grief, or even depression. If we've not experienced these things ourselves, it's likely that someone in our lives or someone we love has. Another way to combat mental illness stigma is to think of mental illness in the same way as we do physical illness. You would never think of someone as weak or less than capable if they had diabetes or if they'd broken their leg while out skiing. And we have to think about mental illnesses in the same way. The reality is that mental illness is simply an illness of our brain, no different than heart disease being an illness of our heart or asthma being an illness of our lungs. Viewing mental illnesses as the same as physical illnesses normalizes them, eliminates associations and blaming associated with them, and removes the judgment and shame around having them. While in the past, and even sometimes now, we may find it uncomfortable or consider it unprofessional to share our personal experiences at work, doing so can serve to bridge the gap and create trust, openness, and safety. As a leader, it's important that we acknowledge and make it clear that mental health issues do not just impact those we lead, but that we ourselves are also human and have the same challenges at times. In order to reduce stigma around mental illness, we need to honestly evaluate our own beliefs and then seek to intentionally reframe them. It's not enough to simply ask our employees about their mental health more often if we are not intentionally choosing to become safe spaces for their disclosures to happen. We need to ensure that we're ready to listen non-judgmentally, maintain confidentiality, and be a safe space for these conversations to be had. When mental health is stigmatized, no one talks about it. But when we talk about it, the stigma slowly disintegrates. We can break down stigma by becoming more comfortable having conversations about mental illness and being honest and open about our own experiences. Research has found that feeling authentic and open at work leads to better performance, engagement, employee retention, and overall employee well-being. Let's take a moment now to review your own beliefs when it comes to mental health. First of all, take an honest evaluation of your own beliefs about mental illness. Do you believe that mental illness is something that someone makes up or something that makes someone weak or unfit for work? Be honest with yourself, as these beliefs will impact how you approach conversations in your workplace and will be inevitably perceived by the person you are speaking to. Next, reflect on whether you consider mental illnesses equivalent to physical illnesses when it comes to their severity, impact, or legitimacy. Depending on the messaging we were given as children around mental health and mental illness, it is common for some to believe that mental illnesses are being made up or are not as legitimate as physical illnesses. This is an incredibly important bias as we address this work. When it comes to sharing your own experiences with mental health in the workplace, assess whether this is something you're comfortable with. Is sharing your personal experiences something that you feel might enhance your leadership in the workplace? In order to facilitate and encourage open conversations, ask yourself how you might be more intentional about creating a culture of non-judgment in your workplace to ensure others in your organization feel safe expressing their own experiences. I'll pause for 1 minute while you reflect on these questions and jot down a few notes. Another obstacle that we can come up against when we're trying to talk to our employees about their mental health is that we don't know when the best time is to ask, or we don't know when to ask at all. In my opinion, it's never a bad time to ask someone about their mental health, but I understand that as a psychotherapist and someone who works with mental illness all the time, my comfort level with this sort of inquiry is much higher than the average person. In general, it's a great time to ask about someone's mental health when you see changes in their usual behavior or presentation. Although sometimes referred to as an invisible illness, mental illness does leave clues if we're careful and watching for them. Specifically, if you notice your usual high performer seems to be lacking in motivation, missing deadlines, or making more mistakes in their work than usual, changes in work habits could be due to declining mental health rather than laziness or poor performance. Someone who's not coping as well as usual may present to work with sloppier clothing, appear less well-groomed than usual, or perhaps accidentally forget to wear the right clothes to work. Changes to personal grooming and external appearance could be great opportunities to check in on your employees' mental health rather than criticize or get after them about it. Mental illnesses impact our mood, our attitude, and how we deal with stress. Changes in mood, demeanor, and affect are all hallmarks of mental health challenges. If an employee appears more sluggish or more tense, seeming on edge or more irritable than usual, it's a good time to ask about how they're feeling. Similarly, if someone who typically regulates themselves well under pressure is suddenly snapping at team members, having mood swings or outbursts, it could be a sign that all is not well with their mental health. Also, if your previously outgoing cashier or carefree assistant is suddenly withdrawn, eating alone, or seeming to avoid social situations, struggling to give good customer service, or seems aloof or withdrawn, it's a good time to ask if everything is okay. Similarly, increased absenteeism or tardiness, while usually viewed as markers of bad employees, may actually be signs of declining mental health. When our mental health is failing, it's common to experience physical symptoms such as body aches, headaches, fatigue, difficulty sleeping, and gastrointestinal upset, among others. Increased usage of sick days may also be a good time to ask about your employees' mental health. While all of the earlier signs are important times to ask your employees about their mental health, there are 2 times that I specifically want you to keep in mind. If you take nothing else away from this presentation, please take note of these 2 important things. First, if an employee voluntarily brings up how they're feeling or discloses a concern to you about their mental health, it is imperative that we talk to them about it at that moment. While it may not always seem convenient, it is so important nonetheless. Nothing is more damaging to a healthy workplace culture or can make someone feel more unsupported than ignoring or dismissing a disclosure from one of your employees about their mental health. If someone brings something up to you, it's important to listen, acknowledge, and provide support. Another really important time to talk to your employees about mental health is anytime you have the feeling that you should. Don't underestimate the power of your own intuition and your ability to detect when someone is hurting. If your spidey senses are tingling, it's likely a good time to ask. Trust that you work with these people every day or almost every day, and that if your intuition is telling you they could use your support, they probably can. The worst thing that can happen is that you're off the mark and they still feel your support, or you could potentially change someone's whole day and maybe even their whole life. When it comes to watching for signs and symptoms of worsening mental illness in our employees or our teammates, it can seem a lot easier said than done. The truth is, we are busy in our day-to-day work, and it can seem impossible to try to keep tabs on how everyone's doing at any given time in our organization. However, the takeaway point from this obstacle is simply that when our employees are struggling with their mental health, they will have some signs. There will be clues. It's not that we need to see every single sign, but we do need to be intentional about paying attention and then taking it a step further and considering whether the change we're seeing could be the result of mental illness rather than ignoring what we see or prejudging someone as lazy or unmotivated. As frontline healthcare professionals, we are experts at detecting subtle changes in the people we care for. When our elderly patients seem to be having a harder time, or when a client needs a bit more medication teaching than usual. And it's these astute observational skills that we're asking you to employ now with the people you work with every day. Consider the questions on this slide to reflect on your own tendency to notice changes in people, your automatic attributions, and whether you can work to intentionally increase how closely you pay attention to those around you. Finally, consider your gut feelings. Trust that as a healthcare professional, you have a finely tuned radar for people who are struggling, and learn to trust it when you detect someone in your organization might be in need of some more support. I'll pause for a moment for you to reflect and write down some notes. Now that we know when we want to talk about mental health with our employees, we might feel a bit anxious about what exactly to say. So I'd like to demystify this right now as well. First of all, you don't need to be a mental health expert to ask your employees about their mental health. In fact, it's probably better that you aren't. When we don't have a lot of knowledge about a certain problem or topic, we can focus on being the best listener possible and focus on our employees' experience and what they may need. We always want to ensure we're focusing on the experience of the other person rather than turning the conversation to our own experiences. This is human nature to try to relate to them, to share that we've felt how they feel, but in the moment, this can seem like trying to compete in struggle Olympics, to center yourself, or like you really aren't listening to support them. However, if you are stuck on what exactly to say, I've created a few prompts for you. It's important to pick something that feels good to you, is relevant to the situation, and doesn't feel like you've rehearsed a pickup line. Keep in mind, it's much more important how you say things rather than what you say. Remember that quote, people won't remember what you said, but they'll remember how you made them feel? This could not be more true in this situation. An individual who is not coping or who is struggling with their mental health is going to feel overwhelmed, anxious, and possibly scared about talking to you about their experience. The most important thing they need to know about the conversation is that you are genuinely seeking to support them and are there for them. Try on some of the phrases on this slide and see if any of them feel good to you. I personally love something simple like, hey, I've noticed you've been showing up a little bit late to work lately. I'm not sure if you noticed this, but I just wanted to check in that you're doing all right. Or you could try something like, is there anything here that's really making your life challenging lately? What would be most helpful to you right now? Hey, you seem stressed. Is there anything I can take off your plate? How can I support you without overstepping? Let's discuss the resources we have available here and what else you might need. You could even say something like, I've been through something similar, and while I don't want to make this about me, I'm open to sharing my experience with you, if and when it would be helpful. When opening up the conversation, focus on keeping your tone of voice light and supportive, rather than intense and probing. If you sense your employee is feeling uncomfortable, be sure to offer them an option to have a conversation with someone else in your network and give them a safe way out of the conversation. We've also put these phrases into a handout that you can access along with this workshop. So now let's talk about creating a safe space to have this discussion with your employees. First of all, being present when talking to your employees about their mental health is an absolute imperative. If you're distracted and unable to be fully present with them, make sure your employee knows that it's a priority and that you will make a point to have the conversation again in the very near future. We're all human and we have a tendency to judge others, even if we don't want to. However, a person who's struggling with mental illness and who's disclosing this to you in the workplace is going to be absolutely terrified of judgment. So it's critical that we're mindful about being judgmental in our thoughts, behaviors, and body language. The truth is that the other person's experience is just that, their lived experience, and we are not in the place to tell them they are misinterpreting things, overreacting, or being dramatic. In fact, making these sorts of assumptions would be incredibly invalidating to the person who's opening up. Keep in mind also that your role in this conversation is not to give advice or fix the problem. It's important to recognize that while some part of the workplace may actually be contributing to or even causing the symptoms your employee is experiencing, this is likely not the time to make rash decisions, changes, or promises about how you intend to make things better. Although it may be hard, avoid becoming defensive if you do feel like the conversation has turned to a domain that is more within your control. The most important thing to remember during a conversation about your employees' mental health is that they are struggling and need your support. As human capital is the most important asset to any organization, we must first seek to ensure they feel supported and heard before anything else. If knowing what to say when it comes to asking someone about their mental health is a challenge for you, don't fret. You're not alone. In fact, the entire reason we put this webinar together is largely due to that exact reality. The truth is that most of us were not brought up having conversations about mental health at the dinner table. Better yet, around people who were not family. Not knowing what to say is common, so let yourself off the hook if you feel a little bit anxious about it. As part of the reflection here, take some time to review the phrases I provided on the previous slide and in the workbook provided. See if any of them feel authentic or genuine to you. We certainly don't want it to feel awkward or like a cheesy pickup line. If you can't find anything that sounds just like you, consider how you might ask a good friend the same question. The truth is, as I shared, the genuine concern and desire to provide support will do more for the conversation than saying the exact right thing. Take a few moments now to review the phrases on the previous slides or brainstorm what might feel more authentic to you. One of the biggest reasons why some of us may feel uncomfortable talking to others about their mental health, especially employees or coworkers, is that we don't know how to handle the disclosure, or we don't know what to do with the information after we hear it. Inevitably, this obstacle comes down to us feeling like we need to fix the problem at the time. And as managers and leaders, let's face it, we typically are in the role of fixing things. However, in this situation, as I've shared in previous slides, fixing the problem for your employee is actually not your job in this moment. Instead, knowing what to do after a disclosure is made is actually a lot simpler than you think. Let's go through these points because they are really important. First of all, it's important to be very mindful of your responsibilities in this situation. You are a coworker, or at most an employer or supervisor. This does not make you a doctor, mental health professional, or caregiver. You are not meant to diagnose, give advice, or do anything other than be a safe, listening ear and being a witness to the other person's experience. The beautiful thing about there being increased awareness to workplace mental health and mental health on the whole in our society is that there have been a development of hundreds of resources available for people struggling with mental illness. Increasing your comfort in talking to your employees about their mental health could take as much as doing a bit of research within your organization or in your local community about what mental health resources exist and keeping a list of them at your desk or on your phone. Consider making a mental health binder with local resources, crisis hotlines, and details about your employee assistance program, for example. With some resources to readily suggest as support options for the person you're speaking to, you'll feel less like you need to fix the issue for them, which is sometimes our instinct as managers or supervisors in a workplace. Keep in mind, mental illnesses can be serious, and we should be on the lookout for more severe signs of declining mental health. Some of these would be expressions of hopelessness, extreme agitation, or withdrawing, worsening substance abuse, physical or emotional outbursts, severe changes in personality, behavior, or cognitive capabilities. If you ever recognize more severe symptoms in coworkers or employees, it is vital to talk to them about it and provide them with crisis resources. Even more, it's important that they know that there is help for them and they can feel better. In some cases, some may be scared to ask about mental illness due to the risk of making things worse, or that we don't know what to do in a crisis situation. The truth here, again, is that it's not your job to be a crisis resource, but what you do when someone is in crisis can make a huge difference. An exhaustive review of how to screen for and support someone who is suicidal is far beyond the scope of this webinar, but one thing remains true. It's a commonly held fear that if we ask someone who is suicidal about whether they are suicidal, that it will make it worse. It's important to know that research shows this is not the case, and the benefits of checking in on someone who is struggling far outweigh the risks. It should go without saying that what is disclosed in a conversation with an employee is confidential unless there is a risk to safety or abuse to a minor child or vulnerable adult. It is important that in doing this work to improve mental health conversations in our workplaces, that we are also addressing our own mental health symptoms and concerns. We cannot model a mentally healthy workplace without ensuring we are leading ourselves first, attending to our own symptoms, and getting the support we need. If we want to have mentally healthy employees, we have to model taking care of our own mental health to embody the culture we want to create. The value of having your own support network cannot be underscored, as knowing about the burdens of those on your staff can and will likely weigh on you. We must be aware of our responsibilities in these situations and specifically remember that simply knowing that someone in our organization is struggling does not mean it's our responsibility to solve that problem. Ensure you're connected with a therapist or mentor who could be an objective listening ear, somewhere to vent and decompress, and encourage you to take care of yourself as well. Knowing where to direct someone who is struggling really is half the battle, and it's a massive advantage. I highly encourage you to take the time and investigate what resources are available in your network and for your organization if you are not already aware of these resources. Take some time, because the time invested now could really help someone in a huge way later. Then, honestly reflect on your own mental health at this moment. Do you feel like it's optimized? Or are there some things you could do or steps you could take to ensure you're really feeling your best? How can you personally demonstrate your commitment to the mental health of your employees and your organization through caring for your own mental health? Take a few moments now to review the prompts on this reflection slide and write down a few notes. In this webinar, we have reviewed the research and data on the startling increase and impact of mental illness in the workforce, as well as some predictions about where it might go from here. We've explored the importance of having conversations in the workplace about mental illness and creating mentally healthy cultures in our organizations. We then explored some of the most common reasons why we might not talk to our employees about their mental health and how to overcome them. We specifically reviewed not knowing when to ask, not knowing the signs to watch for, how exactly to open the conversation, or not knowing how to handle a disclosure. Finally, we reflected on the importance of taking care of ourselves as we do this important work, as well as resources and action steps for learning more and digging deeper. Again, it's important to recognize that this webinar is sharing just a small piece of this important conversation around creating a mentally healthy workplace, and that resources abound for anyone looking to learn more and implement even more change in their organization. Let's now review some action steps you can take from this webinar. First, audit your beliefs and feelings about mental health and mental illness, both in the workplace and in your personal life. Consider how these beliefs impact your comfort level in having these important conversations, inform your judgments, and will influence your creation of a safe space for the disclosures of others. Reflect on your current behavior in your workplace when it comes to mental health conversations, and consider how you personally can work to model a safe mental health culture with your actions, conversations, and openness. Take the time to research resources that exist in your organization and local community, including crisis resources, national crisis hotlines, and warm lines. You could even go a step further and create and post a list of these resources in your workplace, or create a binder where the information can be readily accessible when needed. Finally, as mental health inevitably will impact all of us and our businesses at some point, make a point to learn more about mental health in the workplace by diving into the resources referenced in this webinar. All managers, supervisors, and business owners should take the time to audit their organization and assess their mental health policies. This involves not only how we talk about mental health and support our employees, but also taking a hard look at how we run our businesses and ensuring that policies that are detrimental to mental health, such as those that limit autonomy or reward overwork, are reevaluated and updated. Thankfully, entire organizations have been created with the purpose of better equipping workplaces to create programs and strategies to address mental illness across organizations, and there are expansive toolkits that can be accessed. The Mental Health Commission of Canada is committed to helping employers create and maintain mentally healthy workplaces by providing the tools, information, and support needed to ensure that every person in Canada can go to work knowing that their organization recognizes the importance of psychological health and safety in the workplace. They have also created the National Standard of Canada for Psychological Health and Safety in the Workplace, a voluntary set of guidelines, tools, and resources to guide organizations in promoting mental health and preventing psychological harm at work. The Working Mind program through the Mental Health Commission of Canada is an evidence-based program aimed at reducing mental health stigma, cultivating an environment where people feel comfortable seeking help, treatment, and support on their journey toward recovery. Similarly, for anyone who is looking to learn the skills of supporting someone who is in the midst of a mental health crisis to provide them with the appropriate support until they can access resources, you could consider taking a mental health first aid course from the National Council for Mental Wellbeing. You can find links to these resources and so much more in the toolkit that we have prepared for you that accompanies this webinar. We would like to express our heartfelt thanks to the Ontario Pharmacists Association for sponsoring this session and for your commitment to the professional wellness of the pharmacy community. Thank you for listening. Be sure to check out Part 2 and Part 3 in this webinar series, presented by Amy Oliver. Also, be sure to check out the accompanying toolkit for pharmacy leaders.